everyone, and welcome to our YouTube channel. Today I'd like to talk about what exactly clinical music therapy is and how it's been established here in the United States as an allied healthcare profession. Music therapists can be found in a variety of settings, including psychiatric or medical hospitals, private practices, hospice facilities, skilled nursing facilities, assisted living facilities, school districts, and so much more. Whether you're a member of an interdisciplinary team or you're looking into music therapy for a loved one, it's important to raise awareness about the benefits of this treatment option and understand what to expect from working with a music therapist. If you're interested in pursuing a career in music therapy, I encourage you to visit the AMTA website and find a local school that can provide that education. So let's start today with the definition of music therapy. There are so many ways to explain what exactly music therapy is. It's a treatment that is a little bit hard to define because it is so diverse and so broad in its treatment scope. This is the official definition provided by the American Music Therapy Association. You can find it on their website at www.musictherapy.org. It says, and I quote, "Music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals with a therapeutic relationship by a credentialed professional who has completed an approved music therapy program." So let's break that down a little further. I know that's a lot of information all at once. I'm going to separate this definition into 5 parts and explain it a little bit further for each. The first part of the definition talks about the clinical and evidence-based use of music interventions. Most people that I speak to in passing are often surprised to know that music therapy is an evidence-based profession. From the outside, music therapy can look really fun and inviting and stimulating. You'll usually see a music therapist with a guitar, a piano, and a giant bag of percussion instruments. This unintentionally can create the idea that music therapy is a class or that it's purely for enjoyment. However, the foundation of music therapy comes from its research and theory. This means that our practice is driven by research and evidence. The Journal of Music Therapy and Music Therapy Perspectives are the 2 main publications for peer-reviewed articles within our field. We conduct research as any other healthcare professional would, and we are required to demonstrate continued education in order to maintain our music therapy certification. It's important to know when you see or experience music therapy that these interventions are carefully and thoughtfully selected based on the latest research in our field. The next part of the music therapy definition addresses individualized goals. This is a crucial part of the nature of our services. When a music therapist receives a referral for a particular client, they will conduct an individualized assessment or evaluation. This helps the therapist to understand the client's medical history, diagnosis, and background, but it also serves to determine what the client's needs are. Music therapy can address a variety of domains, including physical, social, psychological, behavioral, neurological, or cognitive goals. It can even expand further to address concerns that are spiritual when working in hospice care. Once the evaluation is completed, the therapist will create objective, measurable goals to be met within a reasonable amount of time for that client. Each treatment plan is client-centered and tailored to meet the specific needs of that person in order to improve their overall health and wellness. When we say that individualized goals are measurable, we mean that we are actively taking data and recording the client's progress, usually as a means of receiving reimbursement for their services. This can look like completing a task with a degree of accuracy, maybe 5 out of 5 trials, or for a specific duration or percentage. So if you see a client playing an instrument in their session, remember that their goals are going to be non-musical. Maybe playing the piano is helping them to improve their fine motor abilities. sequencing skills, or even letter identification skills. The third part of the definition is therapeutic relationship. Music therapists are clinicians. The relationship we have with our clients is similar to a patient-doctor relationship, a physical therapist-client relationship, or a counselor-to-client relationship. We are here as fellow clinical members of the treatment team to address these non-musical goals in a therapeutic environment. I often see people refer to music as therapeutic. For example, they might say, "I always listen to music when I'm driving home from work. That's my therapy." This is a great way for a lot of people to reduce their own stress. I do it too when I'm driving home from work or when I'm driving to the grocery store. However, even though this is therapeutic for us, this is not necessarily music therapy. The relationship that the client has with the therapist is a very important part of their treatment and can determine the progress made on those individual goals that we spoke about earlier. Another important element of the definition is the credentialed professional. A certified music therapist holds the credential MT-BC, or Music Therapist Board Certified. In order to obtain this certification, a student must complete the following steps. First, they must complete a minimum of a bachelor's degree in music therapy or its equivalent. They must also complete 1,200 hours of clinical training through observations, practica, and a 6-month-long internship. Lastly, they must pass the board certification exam administered by the Certification Board for Music Therapists. Although becoming a music therapist takes a lot of training, it's a very rewarding and fulfilling career. According to the CVMT website, there are over 8,200 certified music therapists registered here in the United States. So the last part of the definition focuses on an approved music therapy program. As I mentioned in the previous section, music therapists do have at least a bachelor's degree in music therapy. Schools that offer music therapy degrees can be found all throughout the country. Here, where we're located in Texas, there are at least 3. If you're looking to find a school near you, I recommend visiting the directory search on the AMTA website that'll list all of the universities that are approved to teach music therapy courses. Some programs offer up to a PhD in music therapy and provide classes such as music cognition, the psychology of music, music theory, oral skills, instrumental proficiencies, and clinical skills. As you can see, the term music therapy refers to a very specific clinical setting. It takes a lot of work and effort to become a music therapist, and we're very grateful to all of those who have dedicated their lives to forwarding and advancing this career. Now that we've broken down each part of the definition, let's put it all together. Music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has completed an approved music therapy program. I hope that clears up a little bit of your questions about what music therapy is and what we do here at RGV Music Therapy and Wellness Center. Thank you all for watching this video and for your interest in learning more about the field of music therapy. Please like and subscribe to get the latest updates on our videos. If you have any additional questions, please feel free to reach out to us on social media or leave a comment below. Thank you so much.